Hello everybody, I'm Louis Garcia. I'm a student physical therapist assistant here at Cerritos College, and this is my partner Kat. And I'm gonna go ahead and instruct to you guys how to do basic gait training using a quad cane. So first and foremost, let's go ahead and get to the adjustment before we even begin walking. So what you want to go ahead and do here is you want to make sure that your patient is standing right next to their quad cane. And in terms of proper adjustment, you want to make sure that the crease of the wrist is right next to the handle, okay? Secondly, you always want to make sure that the quad cane itself, they're standing right next to the flat side and not the round side itself. So the round side of the quad cane is always on the lateral aspect, and the patient is always standing to the inside portion of the quad cane. Now, what we're gonna go ahead and do here is I'm gonna instruct Kat to do a simple, basic 3-point, what we call step-through gait pattern, okay? So we break this into 3 parts. I'm gonna go ahead and ask you, Kat, to just bring your cane up first. That's step 1. They're always gonna follow with their bad leg or their affected, meaning for this example, Kat's leg is gonna be, her left leg is the one that's gonna be affected. So I want you to step forward towards the line right there. And now with your right foot, meaning their good leg, they're gonna step beyond their quad cane. So, good, cane, bad leg, and then step over. Good, cane, bad leg, and then step over. Good job. Now, if we wanna go ahead and progress our patient once they're more fluent with their gait training, then we can go ahead and improve that to a 2-point step through gait pattern. Now, Kat, what I'm gonna go ahead and ask you to do is you're gonna bring your cane forward and you're gonna bring your left leg forward at the same time. Okay, so good. Now you're gonna bring your right leg past the line of the quad cane. Good, and we keep repeating that same movement pattern. Good. Cane, bad leg, good leg. Cane, bad leg, good leg. One more time. Cane, bad leg, good leg. Pause right there. And that demonstrates simple gait training using a quad cane.
All right, good evening, guys. My name is Victor Flores here. I'm a student physical therapist assistant here, and I'm going to be showing you guys very quickly how to utilize a walker. So you're going to come across a walker across all settings, really. It's going to be an outpatient, inpatient, no matter where you are. It's a fundamental tool that we use for all sorts of patients, and I'll touch upon that in just a moment. So first off, really quickly, I'm just going to show you on how to size these. So for the most part, you want to make sure that the handles here are right at the wrist crease. And so as you can see, as I stand up tall, we always want the patient to stand up tall. This is a little low for me, so we're going to go ahead and adjust this just to get it a little higher. And to do that, there are these little buttons here that we can go ahead and press, and we can kind of maneuver that. So I'll probably click this up twice on each side here. Give me a moment. And last one. All right. So as you can see, right around there is about my wrist crease. So this will be a good height for me. And so we're looking for just slight elbow flexion. We don't want them to be too high, because then what happens is if they're here, start to increase the amount of work that they're putting into their forearm. So they're going to get tired. You're going to increase their energy expenditure. And if you have it too low, you're going to have their elbows straight, and they're most likely going to end up hunching over or coming into a kyphotic posture, which we don't want. So we want to promote good extension of the spine and good posture. So now that we have this all settled, I'm going to go ahead and show you how to go ahead and safely come up out of a chair, and then how to do a couple of how to walk with this. So I have my over here Louis. First and foremost, always want to put a gait belt on the patient. That's the number one thing. Always patient safety. So we're going to go ahead and feed the teeth first. So I'm going to have you go ahead and lift your arm for me. Good. Place this up and over. Okay, we're going to feed the teeth. Always protect your guys' body mechanics as well. Okay, we're going to feed it through. And I always like to tuck it here just so we don't have a really big tail coming off the end of it here. So types of patients that we'll usually see using a walker, again, it's going to depend on just what stage of their life they're on and what weight-bearing status they have. For the most part, you'll see this a lot in the hospitals. People who come out of knee surgeries, that had total knee replacement, or really any type of surgery or any type of condition where it slows their gait, or it makes them unsafe to ambulate with any other assistive device, like a cane, for example, which requires a little more dynamic stability. So again, this is just going to be depending on the weight bearing status, and if they're safe to walk with something that's not as sturdy. So this has 4 points here, which is why it's called a front wheel walker. 2 wheels in the front, no wheels in the back. Okay, so Louis, I'm going to go ahead and hold on to the gait belt. Let's pretend here he had a right knee surgery here. We had a right knee, total knee replacement. So I'm going to go ahead and actually stand on the side that's weaker. So in this case, it's his right. I'll be holding on here. I'm going to instruct the patient that he can go ahead and push off. So he's going to have his hand on the handle here. I'm going to bring this closer to him. He can have his left hand up here. Good. And I'm going to have him push off the chair, and I'm going to have him pull up with the walker, and I'm going to assist him with that. So on count of 3, 1, 2, 3. Very good. Okay, so let's go ahead and measure this. It's right around his wrist crease here, so it's perfect. We're going to hold on. All right, so since his right side is weaker, we're going to go ahead and actually, I'll show you first what's called a 3-point gait. So we're going to bring the walker forward. Good. We're going to bring the weaker side first, so right foot forward. Good. Left foot next. Good. Now we're going to go ahead and bring again. Walker, right foot, left foot. Walker, right foot, now left foot. All right, now we're going to go ahead and start to progress this patient into what's called a 2-point gait. So this is more of just like a normal walk. We're pushing the walker as we go. So we're going to go ahead and I want you to push the walker as you take that step and just keep on keeping that same motion. So we're going to go ahead and take that step with the walker. Good. Now the next foot. Good. Keep on going. Good. So we're just keeping going. Good. So this is known as a 2-point gait here. Very good. All right. All right. So we just went over what's just kind of what's called a 2-point gait pattern here, where you're just kind of pushing the walker as you go. So that's a more normal gait pattern, which is what we want to progress patients to. So now we taught you how to stand up. I'm going to teach you guys how to safely sit them back down. So I'm going to have you go ahead and continue walking here, Louis. So again, we'll do that 2-point, bringing the walker up as we keep going. So one foot and the other. Try not to have the walker too far in front of them, because again, it's going to have them lean. As we get closer to the chair here, we want to always have them turn towards the strong side. Now that may not always be the case. Sometimes they might not be able to. And in that case, we'll go ahead and turn towards the right. But in this case, because his left is stronger, I'm going to have him rotate to the left. So I'm going to have you go ahead and turn the walker. Good. You're going to take a step with the left and then the right. Good. And again, I'm always holding on to the gait belt. We're going to keep on turning. Good. Keep on turning. Good. Keep turning. Very nice. As he's here, I'm going to adjust the chair for him. We always want to make sure that they back up, touching the back of the chair. So again, we're going to go ahead and step back. Good. We're going to go ahead and hold. Good. Now, again, it is his right side that's weaker. So I'm going to stand on this side. And we're going to go ahead and reach down with the right. Good. This right, again, this is a total knee my example. So I'm going to have him actually scoot the right foot forward for me. Good. Then you're going to go ahead and stick that there. So you're sticking it out. Good. You're going to bring the hip back. Gently come on down. Good. Now, I only do that just because it might be painful for them at the start. Their range is limited. So in any other case, you'd have them just sit down normal. But that's just about it, guys. Just make sure your patient's safe. Always have the gait belt on, and take it off when you're all set.
Hi, my name is Kat. I'm a student physical therapist assistant here at Cerritos College. We are going to be talking about gait training today with crutches. So first things first is the position of the crutches. I'm going to have Louis here be my patient, and we're going to talk through it. So first things first, the position of the crutches, you want the crutches out slightly in front and slightly to the sides. After that, you want to make sure the top of the crutches have about 2 to 3 finger spaces in between his axillary region and the top. So that's about good. And then for the arms of the crutches, you want to make sure that it hits in the wrist crease for him to hold. So this looks good as well. All right, and now we are going to be going through the gait training. We're going to have his right leg be his affected leg or his bad leg. We're going to have his left leg be the unaffected or the good leg. So we're going to say his bad leg, he's going to be partial weight bearing or toe touch weight bearing. So he's going to be slightly on his toes. Okay. And for a 3-point gait pattern, first things first is we are going to have him go slightly forward with the crutches. And then he's going to use his toe touch weight bearing side, his right side, to the line of the crutches. And his good side to the line of the crutches as well. So this is going to be a step 2 gait pattern. So again, crutches, toe touch weight bearing, and full weight bearing. And one more. Perfect. And go ahead and stop. And then to progress this, we would do a step through pattern. So going forward with the crutches again, then he's going to go on his affected side, and then his good side, he's going to go past the line of the crutches. And then crutches, affected, unaffected. Crutches, affected, unaffected. And one more. Stop. And then that is a 3-point gait pattern, step 2 and step through.
Hello, my name is Diana. I'm physical therapy assisting students here at Cerritos College, and today I'm going to explain to you some basics about wheelchair. When you first get a wheelchair, it's going to come in this position. So you always will take the brakes and I'm going to open in this way. Okay? So, and here's the brakes, and in order to activate the brakes, you're going to do it in this position. Okay, one important thing, you can remove the armrest and the leg rest. So to remove the armrest, what you're going to do is click in this button here. So you click the button and then pull up. Okay, let's go try the other one. This way you can remove the armrest. And to put it back, you're just going to click this button here and click. Okay, to remove the leg rest, what you have to make sure is you will have to identify these hooks here, and here's a click that you can open. Okay, and then the way to remove it, you pull up. And this way you can remove the leg rest. So it's very important when a patient is going to sit a stand, you're first going to remove it. So I'm going to show you, my next video is going to show you how to do sit a stand. Now I'm going to explain you how to help someone to sit in a stand from the wheelchair. First, it's very important to remove the leg rest. So what we're going to do, we're telling the patient, move your leg up, or you can help the patient as well. And you remove the leg rest out of the way. And then the other, here I'm going to show you how to facilitate the patient. So you can hold the patient from here, and then that way you can move the leg rest and help the patient. One important thing also, you can help with the patient here and move their wheels so they're out of the way. And then always keep the brakes in, okay? That is a very important safety. Always the brakes have to be on in order for the patient to move through a transition from sitting to stand-up safety. So what we're going to instruct the patient is put your hands on the armrest, lean forward. He can, well, he's out of the way. You can scoot forward a little bit. Okay, so you lean forward and then he can stand up. And this way is easy. And then to sit back, what he has to do is have to walk a little bit, walk towards the wheelchair. He has to feel the wheelchair, and also have to put his hands on the armrest. Bring your butt out, and you can sit.